Yeah. Ready to go. Hi. Well, welcome to our first webinar of this academic year. For those of you who don't know me, I'm Joan Roberts, and I'm manager of the School Health Research Network. And I'm very pleased to be offering this webinar that Graham Moore, who is he's Deputy Director of Decipher, is going to be leading and looking at wellbeing of school and family socioeconomic status and people well-being. So it's an issue of great interest to all working in education. So for those who haven't joined us before on a webinar, just to say that we do these live, but they are then put onto our website so that you can catch up at your leisure. And I know schools have used that aspects of webinar in training, so that would make that easy to do. We've got a range of people who've joined us, the people from our network schools, from Healthy Schools staff, there's National Quality Award staff, and people from the Children's Commissioner office. So welcome to everybody. It's slightly changed the webinar layout since you last joined us, and I have it from a very good authority of Mike, who helps us with these, that it's an easier system. You'll look above where you see our slides and a picture of me and Graham, and there's a little green button with a question mark on it. And all you have to do to be able to type in a question is to press that button. You can do that at any point during our Graham's presentation, but then what we'll do is we'll save the questions and then answer them all in the discussion at the end of his presentation. So I think that's as probably, I think those are the details. The one thing I will say is that, as always, we will be, when this webinar is finished, Cheryl will send out a research brief to accompany this presentation, so you'll have that as a copy as well. So on to the main event, and Graham, thank you so much for joining us, and we look forward to hear what you're going to be telling us.
Okay, thanks, Jane. So what do we need to make the presentation come up?
You should just move on. Yeah, is that right? Or just press on there.
Great.
Oh, okay. You've got, yeah, okay.
Wouldn't be the first time I've had technical difficulties during a teaching session today.
Oh dear. Yes, I didn't mention Graham was a lecturer as well.
Okay, so most of you are probably aware, but the School Health Research Network was established in 2013. Initially, we recruited schools via the Health, Behaviour and School Age Children survey, which is a survey that's happened every 4 years in Wales for the past 20 or 30 years. In 2013, we collected data from about 9,000 pupils in 82 schools. And at that point, 67 schools joined the network. Moving through to 2015, the network expanded to about 113 schools, about half of the schools in Wales. And that's the survey we conducted in 2015 gave us a much larger sample. We had data from about 35,000 pupils within about 87 schools. Now, the current 2017 survey is currently in the field, and we've got 100% of secondary schools in Wales signed up to the network, thanks to Joan. And we're about halfway through the survey period, just a little bit over halfway, and these figures on the screen are actually out of date. This was written a few days ago, and we're already up to nearly 50,000 responses from about 110 schools so far.
Well done, Graham. You've got more up-to-date information than I have.
So in 2013, as well as the pupil data that we collect, schools complete a school environment questionnaire describing policies and practices in relation to health. And in 2013, about 67 schools provided that data. And we were able to link the school level practice data to pupil level health and wellbeing outcomes data. We refined those questions for the 2015 survey. We had about 100 schools take part in who completed the environment survey that time round, and we've just been through the process of refining that questionnaire again, and we're hoping that all secondary schools in Wales will complete that survey for us this time round.
Yes, we echo that.
So there are various uses for the data. Most of you are probably aware that we provide network schools with kind of feedback on the health and well-being of pupils within their schools, benchmarked against national averages. The large data set that this generates is also really useful for kind of national monitoring purposes. So for providing national level information on things like prevalence of e-cigarette use, prevalence of various health and well-being related outcomes, and also for research purposes. It's the latter of these I'll be talking about primarily today. So from the 2013 data, when Shern data were collected as part of health behaviour in school-aged children survey, there are a number of kind of key publications I'll talk through very briefly. The main one that I'll focus on today is the fourth of these. The first paper we published just looked at variability in school health practices across Wales. And this kind of indicated there's some practices that are really consistent across schools. So all schools have things like anti-bullying policies. Pretty much all schools report practices like promoting healthy foods in their school canteen. But there are other areas of health and wellbeing policy and practice that tended to be quite variable. So things like the coverage of school food policy, number of year groups receiving sex and relationships education. And overall, we kind of typically saw that sort of volume of health improvement activity was quite strongly associated with the extent to which kind of senior management within schools kind of prioritised health and well-being. We also saw at that stage a slight trend towards kind of more health improvement activity, a greater focus on health improvement in more deprived schools. One of our colleagues did some analysis using the 2013 data looking at smoking policies, and I mean in Wales historically, going back about 15 years ago or so, there was quite a strong relationship between whether schools had strong anti-smoking policies and the likelihood of young people taking up smoking. But actually we weren't able to replicate this using the 2013 data. I think now we are operating in a very different context. 15 years ago, smoking is much more denormalised than it used to be, and perhaps policies don't play the same role in kind of communicating norms around smoking as they used to. But there were associations of school smoking policies with other substances like cannabis use. So I think, I mean, the main kind of conclusions from these data are kind of, we're not saying rip up your school smoking policies, but keep them in place, but we need to think of other ways to prevent smoking uptake. We also looked, another one of our researchers, Kelly Morgan, did some analysis looking at things like the length of lunch breaks and how that predicted kind of sedentary behaviour and physical activity. So there's some kind of evidence within this of compensatory behaviours. So active travel was associated with near significant increases in sedentary behaviour outside of school time. More sedentary behaviour amongst boys where there was actually more PE in the timetable. But the primary focus of this analysis was around kind of length of lunch break. And generally in schools with longer lunch breaks, there was a tendency for pupils to report less sedentary behaviour in their spare time. We've also got a couple of papers published from the 2015 data. One of these looks at well-being and interpersonal relationships in young people living in foster care. And another focuses on kind of prevalence rates for e-cigarette use throughout Wales using the 2015 data. A couple more papers in press at the moment, one focusing on school level associations between health improvement activities and educational attainment outcomes at key stages 3 and 4, and that's recently been accepted in health education and behaviour. So I'm sure there'll be a webinar on that one later on as well.
So when will we know when that will be? What's the expected time?
Hopefully within the next month or two. Journals are a bit unpredictable.
Right. Okay. Well, it may be that we'll put a couple of things together in one webinar, because that would be very interesting. I'm sure.
And Honor Young, another one of our researchers, has led some analysis on sex and relationships education in schools and variability in sexual health outcomes according to who delivers sex education, so whether it's delivered by teachers or by outside agencies. But today we're going to be focusing primarily on a paper that we published in the British Education Research Journal using the 2013 data, and this stems from one of my own main academic research interests around kind of understanding how things that schools do can serve to reduce socioeconomic inequalities in health and well-being and attainment, but also how things that schools can potentially kind of act to reproduce socioeconomic inequalities that are sort of present within wider society. And this followed on from some earlier analyses we did using the 2009 data that were published a couple of years earlier in the Journal of School Health. And this looked at how kind of health and well-being outcomes, so substance use, diet, physical activity, varied according to school composition, so the percentage of children within a school entitled to free school meals, and family affluence, measured using a kind of standard family affluence scale, and also the interaction between those different kind of socioeconomic influences in predicting those behaviours. Essentially, we found that school and family level socioeconomic status were independently associated with a broad range of health behaviours, and young people from poorer backgrounds had poorer health behaviours overall. But independent of that, independent of their own family socioeconomic status, young people attending schools with poorer overall intakes also had poorer health behaviours. In addition to those kind of independent associations, there were kind of quite clear interactions for quite a lot of health-related outcomes. So inequalities actually tended to be much greater in schools which had more affluent overall intakes. And the kind of benefits of attending a more affluent school in terms of health outcomes tended to be limited to more affluent pupils. So overall, children from poorer families tended to do less well in terms of health behaviours, regardless of which schools they went to, whereas pupils from more affluent backgrounds tended to do better if they were going to more affluent schools. So we extended that analysis in 2013, kind of looking at those independent and interacting associations of socioeconomic status, extending the analysis looking to a broader range of outcomes, including cannabis use, subjective well-being, and also self-rated health. And we also focused on understanding some of the pathways through which schools might kind of contribute to this socioeconomic patterning in terms of things like people's perceptions of their relationships with school staff, relationships with other students, and perceived involvement in school life. Because we kind of theorized, I think that we kind of thought it might be the case that this trend, this interaction might be partly related to young people's position within their school's social hierarchy. So being poor in a school where you're surrounded by other people who are more affluent than you might be psychosocially more difficult to cope with than being more deprived, but in a more deprived school surrounded by other more deprived pupils. So we measured various things within HPSC. So relationships with teachers were measured using a three-item scale, asking pupils to rate the extent to which they felt their teachers cared about them, that they were able to trust their teachers, and they felt that their teachers accepted them as they were. We had similar measures of peer social environment, so ratings of the extent to which pupils felt that other pupils in their school enjoyed being together, were kind and helpful to one another, and accepted them as they were. And essentially, we kind of replicated and extended the findings from the paper in the Journal of School Health. We showed that socioeconomic inequalities, again, were greatest in more affluent schools. And again, the benefits of attending more affluent school in relation to health behaviours were limited to children who were also from more affluent families. But in addition, the analysis, we'd extended the analysis to look at subjective well-being here. And we found in this analysis that young people from poorer families tended to report the worst socioeconomic well-being when they were attending a more affluent school. So this graph here kind of charts the association between family level socioeconomic status and average score on the well-being scale, broken down by type of school. So you can see the blue dot on the far left indicates pupils with low affluence but attending schools with low free school meal entitlement. And actually, it's only really within schools with it's only really for pupils from lower socioeconomic backgrounds that we see that difference between schools in terms of subjective well-being. So pupils from poorer families generally tend to do slightly worse overall in terms of subjective well-being, regardless of what school they go to. But that seems to be amplified when they're attending a more affluent school, where they are a poorer pupil surrounded by more affluent pupils. So I mentioned we had quite a lot of measures of things like perceived quality of relationships with teachers and with peers, and we saw extremely kind of strong and consistent associations between pupils' perceptions of the quality of their relationship with their teacher and all of the health outcomes that we measured, except for physical activity. So for dietary measures, for all substance use, so alcohol, cannabis use, smoking, subjective well-being and self-rated health, all of those things were associated with the perceived quality of pupils' relationships with their teachers. We also saw associations of the connectedness to other pupils within the school environment with health-related outcomes other than substance use. But actually, we saw some interesting interactions with socioeconomic status in that students from more affluent families tended to report better relationships with teachers, better relationships with peers, and more involvement in school-level decision-making. But actually, the associations of school-level socioeconomic status, so the overall socioeconomic composition of the school that the child attends with these outcomes, were a bit more ambiguous. So young people in poorer schools were actually much more likely to report high quality relationships with their teachers than young people who are attending more affluent schools. And that was particularly the case, particularly pronounced for young people from poorer backgrounds. So young people from poor backgrounds attending poor schools tended to report far better relationships with their teachers. And this graph here, again, this charts average scores on the scale for kind of quality of relationships with teachers by family affluence for the three different school types. And you can see actually, even for children from more affluent backgrounds, there's a tendency for them to rate their relationships with their teachers as better when they're attending a less affluent school. But the gap there is greatest for young people from low affluence backgrounds. So for young people from low affluence backgrounds who attended least affluent schools, they actually had the highest subjective well-being of anyone. But children from low affluence backgrounds attending high affluence schools had the lowest subjective well-being of anyone. And we found in our kind of final analytical models that, after adjusting for what young people told us about their relationships with school staff, the interaction effects that we'd seen in our models between school and family level socioeconomic status in predicting subjective well-being were reduced substantially. They became non-significant, which kind of suggests that tendency for poor well-being for poorer pupils in more affluent schools is potentially attributable to that tendency for better quality relationships, better quality kind of teacher-student interactions within those schools. We also saw that the associations of school-level free school meal entitlement, after we adjusted for teacher relationships, those associations slightly increased. So that kind of suggests that inequalities between schools in terms of substance use are possibly actually less wide than they would be were it not for the relatively good student-staff relationships in poorer schools. So essentially, in conclusion, the data, there are lots of limitations with these data. It's a cross-sectional set of analyses. It's very difficult to demonstrate cause and effect. But the main sort of conclusions, the data are consistent with kind of conclusions that pupils from poorer backgrounds appear to benefit less from attending more affluent schools in terms of health and well-being, and potentially kind of social processes associated with kind of relative position in the school's hierarchy may have negative effects on pupils' well-being. And perhaps the tendency that we often see in the literature for schools in more deprived areas to place much more of an emphasis on kind of pastoral care, on supportive social relationships with pupils, benefits pupils from poorer backgrounds attending those schools, whereas pupils from poorer backgrounds attending more affluent schools where there is less of an emphasis on pastoral care perhaps benefit least. But overall, I mean, we tended to see that even for pupils from more affluent backgrounds, schools with poorer intakes tended to do a sort of better job of establishing good quality relationships with their pupils. And those relationships do appear to play quite an important role in reducing socioeconomic inequalities in health and wellbeing outcomes. So I think that's my last slide.
Right. Oh, well, thank you, Graham. God, there's all sorts of things to try and consider there, I think. I'm just going to look at Mike and just see if there are any questions. So, well, perhaps I could kick things off, maybe a question to everybody who's sort of listening. I mean, you know, Graham's saying quite clearly that for staff, that staff-pupil relationship in schools is important in terms of sort of lots of health and well-being areas. And I just wondered if people in schools think that their staff that they work with actually realise that, you know, is it something that perhaps is sort of well known? I mean, obviously in terms of the learning in the classroom, but that the fact that it has a sort of broader impact on the pupils in the school. So that's a sort of general one that I'm putting out there in case anybody has got any thoughts on that, and then maybe, you know, how schools are establishing that really inclusive ethos of support of across the range of pupils. So particularly if you are in a school maybe that has a range of young people from socio-economic varied background. So those are just two things I'm putting out there in case anybody fancies a response. But I'm just going to ask Graham. I know, and you've said that this is an area of particular interest of yours, looking at sort of health inequalities within schools. So I just wondered what, you know, how you would like to develop. You've said, you know, we know that the network, that the more and more people young people are answering the survey and getting that. But I just wondered if you had a thought on sort of, you know, 2 years' time, 4 years' time, whatever.
Well, I think in terms of taking some of this research forward, I think the fact that we've now got much bigger samples is really helpful. And the fact that this year we're, for the first time, asking young people to consent to providing providing their names so that we can follow individuals up over time. So I mentioned one of the major limitations with this analysis is that the data are cross-sectional. And with HBSC data, historically, we've only been working with snapshots, really, because the data haven't necessarily been collected by the same schools, from the same schools every time, and pupils haven't provided kind of identifiable information. But I think analytically, we'll be able to better sort of tease out, using some of that information, the kind of causal sequencing of those issues. In terms of kind of intervention development as well, I think this is a really kind of interesting area for kind of development of intervention, because it's not about asking schools to do anything new above and beyond what they're already doing. It's about kind of focusing on how to do what you're already doing slightly differently, and learning from actually some things that poorer schools actually seem to be doing really very well to support the health and well-being of their pupils. Mm-hmm. And I think also understanding experiences of schooling amongst other minority groups is a really important area that I'm interested in. And I think, again, the big samples that we're working with now really helps us with that. And we've recently got funded a PhD studentship to do some work around understanding social relationships within the school environment amongst young people living in foster care, and how those predict their kind of school engagement and health and wellbeing outcomes. So lots of kind of areas following on from this.
That's exciting. Just to sort of reiterate what Graham was saying about we've got 50 schools who are trialling this sort of data linkage and looking at research over time, and they're being asked if they'd be happy to give their name, date of birth, and a postcode. So we'll be finding out. You'll know if your school is part of that or not, but we'll be, you know, obviously looking at the results of that. So that, yeah, I can see that would have a big importance in this, and use for other things too. So so thank you. That's really interesting. So I think we've just got a different screen. So does that mean that if we press on something, we might? So there's at least one question there. Oh yeah, sorry, I'm just so busy looking at coloured boxes. So Gillian's saying, will there be a summary of your paper available to schools? And yes, so as soon as the webinar closes, you will be sent a research brief, which will talk through some of the things that Graham has been mentioning. And as I say, this webinar will then go up onto the website, so you'll be able to watch it and watch it with other people. I mean, that if you have any queries as a result of this, you can always email me, and I can pass that on to Graham anyway. So I think that would be a sort of interesting, always happy with a sort of dialogue really to talk through any of those. So I don't know if there's, I think maybe perhaps the best thing would be if I just do a little bit of network news, but please, if you've got any questions that this has raised in your mind, then you can certainly ask those. But in the meantime, I will just take you through. It's too good an opportunity to miss, just to sort of let you know how what network news there is. No, I'm sorry. Did that? I thought that. No, that doesn't go. Sorry.
Oh no.
Oh, there we are then. Yeah, or I'll just. Yeah. So, I mean, Graham's given you some of this information, and some of his information on the numbers of young people getting through the survey are higher than mine, because I looked yesterday. So things are moving apace very speedily. So just to say that yes, we have 212 member schools. So it's very exciting that we have all of maintained mainstream secondary schools in Wales, and that's really exciting that we actually have a real national network. So thanks to, I know there's quite a lot of Healthy School staff here, and they helped enormously in terms of recruitment, as did in some areas people from LEAs and from consortia. So we've got a lot of support, and which led to that happening. So welcome if this is your first webinar, but we're very excited that you're now part of the network. So just to reiterate really what Graham said, at the moment you're some of you, and it's now 110 schools are already running the survey or have completed the survey. So some, it was open for the whole of the term to allow schools flexibility as to when they wanted to timetable the survey into what is always a busy time. And I'd put 45,000, but it's nearer 50,000 now. So students have done the survey. There are other schools, about another 100 or so schools that are registered and have either planned the dates that they're going to do it or are planning for completion by December the 21st. And just a little reminder, that isn't the last day of term, it's the second to last day of term, because we felt on the last day of term maybe that wouldn't be the focus of young people really to be filling out a survey. So do get in touch if you have any queries, but a huge thank you to you all, because not only does that benefit your school in terms of you getting your data, but it really does benefit potentially the whole of Wales and then sort of beyond really with the findings from research. Just a little reminder that we only ask schools to sort of do something every 2 years. We offer other things, and we love it when you join us, but what we do ask of you is that you do your student survey in the autumn term, so that will finish by just before Christmas, and then we're asking that you will fill out one school environment questionnaire for the school, and that will be sent to you by the 15th of January, and we'll give you until Monday the 5th of February to have completed that. There's one questionnaire for the school, and that we will send to our link person, but it doesn't mean to say they have to answer everything. So there'll be questions maybe on physical activity that somebody in the PE department might be more able to answer more speedily. So it's a paper copy, and that allows sharing the task, and it's not that you have to do it in one go. It can be completed over those 3 weeks. And just to reiterate what Mike in a school in Flintshire did say, which was that he'd found it a really useful audit tool, and that was echoed by a few other people, just to say what were the health and wellbeing activities, just to let you really focus on what was going on in the school in terms of health and wellbeing. Just another thing, actually, these have been in the latest newsletter, which we sent earlier this term, but I just would like to just remind you, so we've got 2 more webinars coming up next term, and that's one we're looking at. The topic is energy drinks on Wednesday the 7th of February, and then Thursday the 22nd of March. Certainly there may be sort of things that we want to talk about in terms of using your data and suggestions. We ran a webinar last time, you're getting data, and we can give you some of that information, but also the paper that Graham was talking about, which is looking at SRE in schools. And then the same three summer events, one in South, one in West, and one in North Wales, and those are happening between the 12th of June and the 20th of June. And that is a time that schools are saying they're a little bit less busy than normal, but I know that's a very minuscule amount, but that seems to be the best time. So we'd really love to see you all there. So there's a question, I think, that's just arrived. Okay, so this is so Gillian has said that the school environment questionnaire has more questions this year that will help Graham take this work on inequalities research forward. So that's that's great. So that's you heard this here first. So thanks, Gillian. So yeah, that's so I think obviously with the greater focus on health and well-being for you all, I think those that will be helpful for you to consider that. And then if I've still got sign out. Is that my last slide? Maybe that's my last slide. Yes, that is my last slide. So I just want to thank you all for joining us. As I say, if you've got any queries that you want to put to us when you've had a moment, then do get in touch. But thank you so much, and so we will see you all hopefully, or hear you all on the in February. But all the best for the survey, and we'll say goodbye now. And thank you, Graham.
Thank you.